all over the human body. The reactions of wrong blood transfusion or problem with the blood that has been transfused is quite often disastrous. Well, not in all cases does it end with disaster, but it starts, for example, we have cases when fever develops, the patient is feverish. Permit me to start by saying that most of these reactions lead to the destruction or what we call the hemolysis of the red blood cells, when these red blood cells just go bust. And when they bust, we say they have hemolyzed. So in some cases, we find a feverish reaction, the patient is feverish, but luckily the red blood cells do not burst, they do not hemolyze. We also have the other type when the fever is there, but for example the blood hemolyzes, that is the red blood cells go bursting, and because of this the patient develops a lot of chills, that is cold chills. There's a lot of headache, there's a lot of backache, there's a lot of difficulty in breathing, chest pain, fast breathing, increase in the heart rate. All these signal the fact that a lot of red blood cells by this reaction have suddenly, under a very short period, been destroyed. And of course, you can have the infectious diseases resulting from contamination of the blood by bacteria and virus, and of course the patient will definitely suffer from the signs and symptoms of those bacterial and viral infections. And of course, we have this popular thing we call the TRALI, that is the transfusion-associated acute lung injury. When there is respiratory distress, there is a very high fever, and there's the water collecting in the lungs, what we call pulmonary edema. And of course, this usually results in a fast drop in the blood pressure, hypotension. Now, sometimes when these reactions occur, we have volume overload, because once these reactions occur, you see, you feel as if you are not giving the right quantity of blood, and there's a tendency for you to increase the quantity of blood you are giving. This leads to volume overload in such patients. And of course, when you continuously give blood transfusion, you realize that a lot of these red blood cells that are being transfused are not absolutely very healthy. They are not very healthy. They do not survive for the 120 days that the naturally produced red blood cells will survive. So their lifespan is usually shorter, which means that they hemolyze quite earlier than the 120 days. As a result, the iron content of these red blood cells accumulate in the blood circulation and leads to what we call iron overload, the iron coming from the hemoglobin of the red blood cell. And when this happens, you know, there's problem with the spleen. It bogs down the spleen with this high content of iron and leads to partial disability of the spleen. And of course, you know that the spleen controls the immune system to a large extent, and whenever its functions are disturbed, there are consequential infections arising. And of course, we have the acute hemolytic reaction, the one I was talking about, the fast reaction, which leads to death within minutes. So if you look at all these conditions, it's very dangerous if we make a mistake during blood transfusion. That is why quite often we are not in support of blood transfusion except in very acute cases. For example, people who take some very dangerous drugs, and these drugs exist in them while donating blood, and the blood transfusion center probably at that point in time do not possess the wherewithal, the ability to detect these drugs. There is one dangerous drug called rhopacia, which killed a lot of people when it was inadvertently transfused during blood transfusion to some unlucky people. We have the West Nile virus, a very, very virulent virus that was transfused to people inadvertently. And syphilis, Treponema pallidum, has been transfused on very many cases inadvertently. And of course, the human T lymphotropic virus, which causes a lot of horrible diseases in human beings, has been transfused. And of course, there's a problem with platelets. You know, when the hemophiliacs are being transfused, we make sure that the blood is fresh, because keeping blood in room temperatures cause the platelets to get infected, and if these were to be transfused into them, quite often it is very desirous. Mad cow disease, for example, and not to talk about the numerous, many yet undiscovered viruses that are still around, but unfortunately have not been detected. And unfortunately, for example, no one has ever thought of them existing in human blood.
The numerous side effects of transfusion has been identified, and more are being recognized by the day. The availability of donated blood is not meeting demand, therefore stimulating the need for transfusion substitute to keep the volume of circulating blood at desired volume and pressure has been introduced. Many types of plasma expanders have been introduced. Fresh frozen plasma are now given to manage coagulopathies. Synthetic erythropoietin injections now available are given to boost RBC production. Unfortunately, with recent identification of some side effects, a caveat has been slammed on erythropoietin by FDA of America. With better understanding of the process of RBC survival in the human circulation, introduction of powerful AOs into the system has greatly improved the methodology of maintaining the quality and quantity of blood while in human circulation.
The medical world has always been looking for substitutes for blood because of all these dangerous contents of blood to be transfused. It's very difficult to manage blood outside the human circulation, and therefore there's always been a lot of problem. The Jehovah Witnesses are absolutely, although theirs is based on religious beliefs, but medically you have seen what I've mentioned, that there's a whole string of problems attached to blood transfusion. So the medical world has always been searching for solutions that will lead to the substitution of blood using some other substances. Now, basically what we want is to keep circulation going on. So the first thing you want to lean on if you don't have blood around is to keep the blood volume, that is the blood volume, stable at what it used to be, and also to stabilize the blood pressure so that the little blood you have will be able to keep the pressure of circulation going on. Furthermore, there is this wonderful injection that has been used from time immemorial called the erythropoietin. Unfortunately, when this erythropoietin is given, although it helps to improve the quality of the blood production, you must add a lot of iron. And of course, recently, March 2007, it was discovered that it has some problems. It caused some problems with the kidney and the cardiovascular system. So there's a little caveat ordered by the FDA of America for doctors to be very careful when they are using erythropoietin. It has a lot of side effects, which includes flu-like symptoms, headaches, hypertension, skin irritations, and rashes. But check this out. Despite all what I've told you, there is a much more simpler way of substituting blood. That is, listen to this, you drink a lot of water, take Jobelyn every day, and within a couple of days, your hemoglobin and your PCV is up to kingdom come. Take my word of it. It works like magic. And of course, you can add your plasma expander, add your Jobelyn, your blood pressure will go high, your hemoglobin will increase, your PCV will improve. It has no side effects, and your results are out within a few days.